Hey everyone, it's Dr. Bacala. Welcome back. I wanted to talk about, in this lecture, I'm going to talk about diabetic medications and how they all function and what their mechanism of action is in our bodies. So let's just get right into it. We'll see you guys at the board. Hey everyone, it's Dr. Bacala. Welcome to the board. Like I said, we're going to talk about diabetes mellitus type 2, the pharmacology of the medication specifically, of course, and the different types of medications. As you know, our patients with diabetes, there's a lot of different types of medications that we should know and understand. But the best way to do it is a diagram. I drew a diagram here to kind of help understand how these medications work, so let's get into this. So basically, this is the stomach, this is bloodstream, the pancreas, right? The liver, adipose tissue, and skeletal muscle. So I'm not the best drawer, but I tried my best here. So let's talk about what happens in a normal situation, right? In a normal situation, what happens is when we eat, food goes into our stomach, it's broken down, and what happens is in the bloodstream, glucose increases, right? So glucose increases, after a meal, right? So in the pancreas, we have there's cells in the pancreas. The one that's very important here is the B cell, right? So the increase in glucose in the bloodstream, it is then absorbed. What happens is once it's absorbed, it stimulates the pancreas B cells to release insulin into the bloodstream, right? So once the insulin is in the bloodstream, there's a few things that happen, that occur. Insulin goes to the liver, and what happens is it makes the liver have a glucose uptake, increases glucose uptake, and then it goes into the skeletal muscles, and it also causes the skeletal muscles to increase its glucose uptake to kind of control that the glucose levels in the bloodstream. So basically, in diabetes mellitus type 2, if you really think about it, it's the resistance of insulin resistance is what happens in type 2 diabetics. It's insulin resistance. So over time, if there's insulin resistance, the B cells in the pancreas actually, they get damaged, they atrophy, right? So the whole role of insulin is to bring down the glucose levels in the bloodstream to prevent hyperglycemia, to control that. So that's kind of the gist here with this diagram. But now let's get into the medications, all right? All right, so the first class of medications are called biguanides. And the most common biguanide that we know of is metformin. Metformin is the first line medication for our type 2 diabetics. So, and the main, biguanides work in the liver. So let's get into that. So again, we said biguanides. So biguanides, the more common was metformin. And a few things, it does a few things here. So one, it increases insulin sensitivity in the liver. It also increases glucose uptake. And also decreases glycogenolysis. And glycogenolysis is actually the breakdown of glycogen into glucose. Okay? So the mechanism of action is, metformin, again, increases insulin sensitivity, so it's easier for glucose to get into the liver. And what happens in the liver is that, molecules are formed, and it actually, glucose will be stored eventually as glycogen in the liver. But glycogen can turn into glucose as well. So metformin will inhibit this process called glycogenolysis. So it will inhibit glycogen to the breakdown of glucose. So that's what that does to kind of help regulate the elevated sugar levels or hyperglycemia in our bodies. Now, some side effects of metformin are, the nausea, vomiting, GI upset, and lactic acidosis is what we watch out for. So again, that is the first class of biguanides. So the next class of medications are called the sulfonamides, and we know in this class the main medications we know of are glipizide, glyburide. Those are the most common medications. So these mainly work in the pancreas. So let's talk about that. So again, we're talking about the sulfonamides. The common medications are glipizide, glyburide, and the way it works is that these medications just really, they just tell the B cells in the pancreas to produce more insulin. That's what they do. They stimulate them to produce more insulin. And the way it works is that there's potassium transporters in the pancreas, and they inhibit that. And what happens when they inhibit that potassium transporter, it causes it prevents the stream of potassium out, causing a depolarization. The depolarization then stimulates the B cells to release more insulin into the bloodstream. So that's how that works. The more common side effects of these type of medications are hypoglycemia, and also weight gain. Weight gain is also one for these medications as well. So that's how sulfonylureas work. Let's get to the next one. So the next medications are called glittazones, and one of the more common medications in this class that we know of are glittazones. And they do a few things. They actually increase insulin sensitivity and also decrease the free fatty acid release. So let's get into that. This is the adipose tissue here. So again, they're called glittazones. And piglatizone, which I know I'm spelling this wrong here. So piglatizone, bear with me, is the more common medication there. And what this does is that it increases insulin sensitivity and also decreases free fatty acid release in the adipose tissue. All right. So again, increases insulin sensitivity, decreases free fatty acid release in the adipose tissue. This in turn, since there's a decrease in free fatty acid release in the tissues, and actually in the bloodstream, it'll actually increase insulin sensitivity. So that's how glittazones work. Common side effects we need to be aware of for this medication is that it could cause peripheral edema. It also could cause salt intake, swelling. We've got to be very careful with people with congestive heart failure when they prescribe these medications. But that is, again, glittazones. So the next class of medications that we're going to talk about are called alpha glucosidase inhibitors. And the more common medication that we know in this class is acarbose. These medications work in the small intestine of our GI tract. So let's get into that. So these medications, again, are called alpha glucosidase inhibitors. And the more common medication is acarbose. All right? So alpha glucosidase inhibitors, acarbose is the common medication. So what these do is, they work in the small intestine of our GI tract. And in the small intestine, when we eat a meal, they're broken down to short branch carbohydrates. And then there's an enzyme that causes this breakdown into macromolecules called glucose. And of course, that's what glucose is then absorbed into the bloodstream, right? This medication inhibits that enzyme called glucosidase. And basically, through that, it actually causes a decrease in glucose absorption. So that's what that is. So again, what happens is, we have these short branched carbohydrates, all right, and then they're broken down into, glucose. This alpha glucosidase inhibitors is the enzyme that's a catalyst that is broken down into glucose. The medication then inhibits this enzyme here, so therefore causing a decrease in glucose absorption. Some of the side effects that we have with these medications are, really bad flatulence. People have diarrhea, really stomach upset, things like that. I would avoid these medications in our patients with irritable bowel syndrome or inflammatory bowel disease like Crohn's disease or ulcerative colitis. But that's how acarbose, that medication, works. Let's get into the next one. The next class of medications we're going to talk about are GLP-1 agonists. And, some examples of these medications would be like, Trulicity, there's Byetta, Victoza. These are all medications called GLP-1 agonists. And the way they work is they work also in the GI tract, specifically in the intestine. So let's go ahead and erase this here. So we're going to delete all this stuff, erase this. So again, the way the GLP-1 agonists work is that, so let's go ahead and write it down here. So GLP-1 agonist. Examples would be like, again, Trulicity, Victoza. These are just a few of the common medications that we use for this. So the way it works is that the body, when we eat a meal, it goes into our stomach, into our intestines. The intestines will release something called incretins, and incretin is basically a GLP-1 agonist. And what the GLP-1 agonist does is it does a few things here. It stimulates the B cells of the pancreas to release more insulin. It stimulates the alpha cells in the pancreas to decrease glucagon as well. So in turn, this will, of course, increase insulin release. It will also decrease gastric emptying as well as decrease appetite. So that's how GLP-1 hormone works. Now, GLP-1 agonists, like these medications, overall just causes that to be even more. It's times 2 type of thing. It releases more. It's able to do that. Kind of mimics that hormone in a sense. So that's how that class of medication works. Now, what are the side effects? People usually will have nausea, headaches, and things like that. That's associated with these type of medications. But let's get into the next one. All right, so the next medication that we're going to talk about, our class of medications, are called DPP-4 inhibitors, which are dipeptidyl peptidase 4 inhibitors. And medications that we know of in this class are the sinagliptin, litagliptin. These are those type of generic medications that are in that class. They work really closely with, again, they also work in the small intestine. And the way they work is that, as we talked about earlier, GLP-1 is the hormone that causes a lot of things. It actually stimulates the pancreas B cells to increase more insulin release. It also decreases in the alpha cells glucagon. So, and again, it decreases gastric uptake. It decreases appetite. Well, DPP-4, the enzyme, actually inhibits the GLP-1 hormone from doing all these things, right? So, in this case, these medications, we'll write this down here, called DPP-4 inhibitors, like in sinagliptin. All right. These are some of the common, medications. So what these do is they inhibit. This will inhibit the breakdown of GLP-1 hormone. So in that case, that in turn also stimulates again insulin release and all those things. Some side effects that we deal with these medications again are gastric upset, nausea, and things like that. But that's how DPP-4 inhibitors work. So the next class of medications actually work in the kidneys. So let's get into that. Let's go ahead and erase this here. So the next class of medications is called SGLT2 inhibitors, and that stands for sodium glucose cotransport inhibitors. So let's go ahead and write that down. So again, it's called SGLT2 inhibitors. All right. And again, this stands for sodium glucose cotransport 2 inhibitors. All right. But the difference, they differ from all of them because this one actually works in the kidney. So let's go ahead and draw our kidney here. Kidney. Let's see if I could draw a good kidney here. All right, that's decent. So again, the way these common medications in the SGLT2 inhibitors are, medications called canagliflozin. Have I spelled that right? That's a common medication in this class. So the way they work is this, right? So they mainly work obviously in the kidney. There's nephrons in the kidneys, and the nephron is divided up into a few things: the glomerulus, proximal tubule, loop of Henle, convoluted tubule, distal convoluted tubule, and the collecting duct, right? These medications work specifically in the proximal tubule. And what happens is in the normal conditions, we absorb glucose into the bloodstream through the kidneys, and we should not have any glucose in the urine, correct? So in this one, the SGLT2 inhibitors, they inhibit the receptor that absorbs the glucose into the bloodstream, thus far having, you're going to have glucose in the urine, and actually decreases the glucose levels in our body. So that's how this medication works to treat type 2 diabetics. Some side effects that we want to be careful of are people can have urinary tract infections. They're also going to have glucosuria, glucose in the urine, basically. So again, These are all the different types of medications in type 2 diabetics. The one I didn't mention is because it's the easiest one. It's basically insulin. You know, you could typically we give insulin to our patients with type 1 diabetics, but in type 2 diabetics, if they have a really uncontrolled or very severe type 2 diabetes, we also put them in insulin. And the way that works is that it's really simple. We just inject insulin into the bloodstream, right? So that's that one. I saved that one for last. But I hope that all this kind of gives you an idea of how all the different types of type 2 diabetic medications work. But I always suggest to look back and read about these medications and learn it for yourself. But also, just look at this diagram to kind of help you put everything together. Thanks for listening. We'll see you guys next time.